So, Dr. Quinn, I remember you told me that many people have been visiting you thinking they have COVID when they actually have allergies. So, what's the difference between seasonal allergy symptoms versus COVID-19 symptoms?
Well, it's so funny you ask. I mean, this is a very unusual year. Notice I'm wearing a jacket right now. Is it hot? Is it cold? It just depends on the day. But the deal is the allergies are coming. And a lot of my patients are coming in and they'll have the itchy eyes, the runny nose, the coughing, the sneezing. This is more characteristics of allergies. But remember, COVID is a very vague infection where you can have some of these same symptoms, or you can even have a combination of both. But what I use to distinguish COVID from allergies are usually with allergies, you won't have the fever or the muscle aches. Now, you can see that in COVID quite a bit, but also with COVID, it's now classified with the CDC that you can have those GI symptoms like the nausea, the vomiting, the diarrhea. So these are some distinguishing characteristics that can kind of help us out, but we still go ahead and do that COVID test if we have suspicion, because if someone has COVID, we want to identify it and get them separated to cut down on transmission.
And what are the possible treatments if someone does have allergies?
Well, basically, you know, with the treatment for allergies, if we do the COVID test and it's negative, then we'll treat the allergies. And the frontline treatment are the antihistamines, like your Zyrtec or your Claritin, and you can get it over the counter. And it's unusual a doctor tell you to go over the counter, but you can, and you can get them over the counter, and then you can do the Flonase nasal spray. It's a steroid. It works very well in combination. You can get that over the counter as well. And then if that doesn't work, you can add the Singulair, which is a prescription. It works along with it to help. And then for those out there that are just really suffering, in the state of Mississippi, you have to have a signed prescription for the Sudafed. That helps as well. So these are some of the treatments that we employ and helping people to get better.
At least you know the difference now between allergies and COVID. And so if people do have allergies, will it be more likely for them to contract COVID?
Well, the CDC, I checked out the CDC website, and it did indicate that this is not yet determined. But it is true that if someone does have allergies, you know, they do have the runny nose, and they can have a slight weakened immune system because your body is dealing with the allergy. So it is a possibility that if they come into contact with COVID, they'll have less of a fight. But the bottom line is if you have any symptoms, go ahead and get checked out during this COVID pandemic. And that way we can test for everything, allergies, COVID, and even the flu, which we're seeing some cases of the flu right now.
All right, well, good to know. Well, thank you for joining us, Dr. Quinn. We'll be right back after this break.